name is Dr. Naveed Merali. I am the head of Department of General and Interventional Pulmonology here at the Avenue Hospital in Nairobi. Today I'd like to welcome you to our cath lab. This is one of the most advanced units or one of the most advanced cath lab systems on the continent. And this is where we carry out advanced diagnostics for patients with lung nodules or lung tumors. One might ask, what does a chest specialist have to do in a cath lab? This is actually where we do our advanced diagnostic testing for the evaluation of lung nodules, lung cancers, to collect specimens from growths or tumors in the lungs in a low risk and highly effective way. The whole procedure is done here. We actually set up our bronchoscopes or our camera systems that go through the mouth, through the windpipes, and we use all this setup to navigate through the maze of the airways to be able to locate nodules as small as 5 millimeters in size and to collect samples or to biopsy these nodules so that we can diagnose lung cancer in the early stage. If we are able to diagnose lung cancer at the nodule stage or at stage 1, then we can actually offer the patients curative treatment, and the lung cancer survival rates can go as high as 80%. We started these procedures actually in June this year. We were the first center in East and Central Africa to do lung nodule diagnostics using this advanced technology. And we've done more than 40 or 50 cases so far. This is actually our cone beam CT machine. This machine is high-tech. It actually rotates 360 degrees around the patient and can give us real-time CT scan quality imaging as we do the procedure. So we actually do the procedure under a 3D imaging system, which is this machine here. As we're doing the procedure, the patient's lungs come up on display here. We can see in real time where the nodules are, for example here. Where is our bronchoscope, or where's our camera system? Where's our biopsy tool? And in case we need to make any adjustments, for example, if we target the wrong area, we can check and say, okay, make an adjustment, adjust the direction, and let's get the right place. This guarantees us that when we're doing your procedure, when we're doing the biopsies, we actually biopsy the right place all the time. So on my laptop here, this is our planning software. The software is called Synapse 3D. It's a specialized navigation software. So we load the patient's CT scans onto this, and it can give us a full 3D reconstruction of the patient's lungs. We can then use this to find the optimal pathway to get to the nodule. We use this during the procedure, so this can actually run concurrently as we're doing the procedure so that we know that we're actually following the right way. It reduces the time we take when we do the procedure, so we keep the patient under anesthesia for a little bit less. For planning, it makes things much easier, and it generally just, when we put it all together with the imaging, the software, the correct equipment, the right anesthesia team, then everything really comes together beautifully. For us, this is really good because it provides us minimally invasive options to diagnose lung nodules. It gives us safe options and accurate options. And that's what we need as your doctors. We have a dedicated interventional pulmonology clinic that runs here at this hospital that is tailored to the patients who are undergoing investigation for lung cancers, lung nodules, and need this specialized kind of biopsies. If you are a patient and you do need evaluation for this, then please feel free, make an appointment, come and see us. We can give you the options, and we can actually give you the best diagnostics and the best pulmonary therapeutics in this region.